Hello everyone, I am Dr.Madhu Shankar, Hypertension and Kidney Specialist at Sri Ramakrishna Hospital, Coimbatore, and this is my YouTube channel, Ask Dr. Madhu. Most of us might have come across a news recently that an young aspiring actress consumed a form of diet called keto diet, which led to her kidney failure and eventually she passed away. Sad news. But most of us might have thought, this thought might have popped up in most of our mind. How can some form of diet be this detrimental to the kidney, leading to life loss? Is it really worthwhile doing that form of dieting? If it is this dangerous, why are someone even advising about it? Why are we even following it? Let us look into it. So, for our day-to-day functioning, the body requires some form of energy which we take it from the diet. The three major forms of energy from our diet are carbohydrates, protein and fat. Carbohydrate is the most preferred form of energy. 1 gram of carbohydrate gives us about 4 kilocalories. Excess form of carbohydrate is stored in our liver and muscle as glycogen. If you do not take any food and you keep doing some continuous activity like cycling or running, the glycogen can sustain for 45 minutes to 1 hour, and then body starts consuming fat. Fat is a very rich source of energy. 1 gram of fat can give you up to 9 kilocalories. And then comes protein, and 1 gram of protein can give you up to 4 kilocalories. The body prefers carbohydrate, fat and then protein as a source of energy. When you are deprived of food for a prolonged period of time, like weeks to months, then you lose weight, you lose fat, and then eventually your muscles are lost, and then you become very skinny, you become cachectic. So this is how the energy process in the body is. A balanced diet usually consists of around 60 to 65% of carbohydrate, around 15 to 20% of protein and 20 to 25% of fat, along with essential vitamins and minerals. So what is this keto diet? Keto diet is when you reduce carbohydrate to the tune of 5 to 10% and substitute it with the fat, thereby helping in weight loss. Medically, this was found beneficial in children with epilepsy, seizure disorder, and it just came to someone's mind that when we cut off carbohydrate and stimulate fat as a source of energy, the weight loss can be facilitated because body starts burning fat. Someone implemented it and found some success. When celebrities all over the world and India started following it, this became famous through social media and all forms of communication. So the percentage in the keto diet is predominantly of fat, which constitutes around 70 to 75% of the total diet, and some protein, which is around 20 to 25% of fat, and carbohydrates, which is 5 to 10%. So the question is, when we take this form of diet, can this affect the kidney? Well, as of now, be it a keto diet or paleo diet or any other form of diet, we do not have any evidence to sustain that this form of diet can directly affect the kidney. But while following the diet strictly, when we start taking more processed foods, the chemicals in the foods can damage kidney or liver or heart. Or when we have some baseline problem with kidney functioning or heart or liver, then also the problem can get aggravated. Right. So then I know of someone who has diabetes, who was obese, who had an excess weight. He started following paleo diet, and to my surprise he's lost weight, and at baseline his doctor told him that he had some problem with the kidney functioning. His creatinine is high, he's leaking protein in the urine. But 6 months later, in addition to weight loss, his creatinine has also come down, and the protein that was leaking in the urine also has come down. So doctor, does that mean that paleo diet can do wonders to the kidney? Well, this is a question for thought. As I have told you in my previous videos, diabetes, high blood pressure, cholesterol in the blood, obesity are all a part of metabolic syndrome. When you follow a diet, you bring down your weight, hence you control your sugar, pressure, fat. So that helps kidneys, not only kidneys but also liver and heart. So if the functioning or if the dysfunction with the kidney is in the initial stages, there is a good chance that it can be reversed. So it doesn't mean that the diet is directly favoring your kidney, but through control of the multiple metabolic factors, your organs are benefited. So doctor, I'm getting a little lost here. You're telling me that the diet cannot directly harm the kidneys and the diet can also directly not help the kidneys. So what do I do? I'm really confused. Well, if your aim is to lose weight, the best way is to do a proper balanced diet containing carbohydrate, protein, fat in a prescribed recommended proportion, along with vitamins, minerals, and regular physical activity. I would rather recommend you to look into the quality of the food that you consume, the quality of the fat, avoiding processed foods, and following at least 3 to 5 days of active physical exercises a week with 20 to 30 minutes every session. Taking any extreme form of diet, avoiding carbohydrates or avoiding fats may benefit you in the short term, but sustainability and following it up beyond 3 or 4 months is always difficult. So the best way is to stick on to a prescribed and adequately proportioned diet with vitamins, minerals, and a regular physical activity and good habits. Based upon your profile, a little low carbohydrate diet may help you, but always make sure you do not miss out on protein or fat, because weight loss should be healthy. So is your daily habits and physical activity. Only then it can be followed on a long-term basis and hence help your organs, kidneys, heart and liver. Healthy living, mindful eating, good habits. These are the keys to a long and content life. Thank you.